No more sleep apnea. People with sleep apnea often present with daytime sleepiness, loud snoring at night, episodic gasping or holding of breath, pauses in breathing, and sudden awakenings while snoring. Sleep apnea increases the risk of certain medical illnesses and premature death. Although the diagnosis of sleep apnea is based in part on a doctor's assessment of symptoms, doctors often use polysomnography to confirm the diagnosis and determine the severity of the condition. Continuous positive airway pressure, dental appliances, and sometimes surgery may be used to treat sleep apnea. Sleep apnea is a very common problem. More than 1 billion people worldwide are affected by the disease. There are many types of sleep apnea, with different causes and risk factors. Sleep apnea is divided into two types: obstructive sleep apnea, central sleep apnea. Some patients combine obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea, the most common type of sleep apnea, is caused by the throat or upper airway closing repeatedly during sleep. This type of apnea affects the health and condition of approximately 8% to 16% of adults. Obstructive sleep apnea is more common in obese people. Doctors diagnose obstructive sleep apnea when breathing is interrupted during sleep. There are at least 5 breathing interruptions per hour. Each interruption lasts more than 10 seconds. Many risk factors increase the likelihood of obstructive sleep apnea. Obesity, perhaps combined with aging and other factors, can cause the upper airways to narrow. Alcohol use and sedative use can worsen obstructive sleep apnea. For example, a narrow throat, a thick neck, and a round head increase the risk of sleep apnea. Obstructive sleep apnea can result from low levels of thyroid hormone, hypothyroidism, from gastroesophageal reflux disease, GERD, or nocturnal angina, or from excessive and abnormal growth due to overproduction of growth hormone, acromegaly. Obstructive sleep apnea in children, enlarged tonsils or adenoids, certain dental conditions such as a deep overbite, obesity, and certain birth defects such as an abnormally small jaw can cause obstructive sleep apnea. Seasonal allergies that cause severe nasal congestion can worsen sleep apnea. Central sleep apnea is less common than obstructive sleep apnea. It is caused by breathing control problems in the brainstem in the brain. In central sleep apnea, the brainstem is unable to respond appropriately to changes in carbon dioxide levels. Therefore, during sleep, a person with central sleep apnea may have their breathing pause or be shallower and slower than normal.